go.
Good morning, guys. It's Dr. Denny over at Four Paws at Fulshire Veterinary Clinic, and today Maddie and I are going to chat a little bit about what to expect when your cat is having surgery. So hopefully this will help answer any questions, allay any fears that you may be having or anxiety. Maddie's going to get us started with some questions.
Dr. Denny, when are cat surgeries considered elective, non-elective, or emergency?
So elective surgery is going to be when something is not going to save a life in that exact moment. Okay, so elective surgery is going to be your spays, your neuters, declawing, which we don't personally do here. I don't judge those who do, but I'm not personally going to do this surgery. So those are going to be like your elective surgeries. Your non-elective surgeries are going to be things that have to get done. So your cat's broken its leg, it needs an amputation, or your cat's been hit by a car and has a huge chest wound, or your cat's been attacked by another cat and has an abscess that needs to get lanced and drained and a drain placed. Those are going to be your non-elective procedures. And then of course your emergency procedures, which I kind of already touched on, but broken bones, hit by car, dog attack or cat attack, things of that nature.
What are the most common cat surgeries?
Spays and neuters. For us anyways, I think the second or the third most common is going to be abscesses. When cats have really, really disgusting mouths and their bites get really infected. So it's very common about a week after a cat's been in a fight that they will develop some sort of abscess, which is a kind of a swelling, and that swelling needs to be lanced, drained, and in some cases a drain needs to be placed.
Will cats need lab work done prior to having surgery?
So we strongly recommend preoperative lab work for all of our patients. It is optional for those patients that are under 4 years of age, but the preoperative labs are really, really important because it helps screen for liver or kidney dysfunction or infection or a clotting disorder. So these pre-screening panels are super, super important. We make them optional for young pets to make sure that our spays and neuters remain affordable. And most of the time the labs are going to be normal, okay? 100% most of the time the labs are going to be normal. But occasionally you will get one that's not normal. And that is so crucial to know before going under anesthesia, because we may decide not to put that patient under anesthesia because of elevated risk factors. So it's all about the health of your pet.
What do I need to know before my cat has surgery?
So you should know, what day the surgery is. You should know that, don't feed out, after 9 the night before, water's fine, and then no breakfast the morning of. You should know what time you are dropping your pet off. You should have all anesthetic paperwork filled out, hopefully prior to dropping your pet off. If not, that'll be gone over the morning of. I would make sure that you ask your veterinarian, or if it's us, when to expect the cat will go home from surgery. These are probably going to be the top things to ask.
Who will be monitoring the cat while under anesthesia?
That's a really good question. We do a lot of monitoring here. So I usually have anywhere from 2 to 3 technicians on with me on my surgery days. And it's 2 dedicated nurses, getting them under anesthesia, and I'm right there with them. So you have 3 people monitoring your pet the entire time. I know even when I'm doing surgery, yes, we're taking vitals like every 5 minutes with the EKG, blood pressure, oxygen, CO2, body temperature. But it's not just my nurse that's monitoring. I also do look up and I'm checking the monitor, in between, movements. So, we're very, very cognizant of monitoring our patients.
How long is recovery after a cat surgery?
So most patients are awake and recovered within about an hour after their procedure. I like to keep them for a good 3 or 4 hours in most cases to make sure that they wake up okay, make sure that their pain control is all right. And then if they've had a procedure, it's usually 10 to 14 days. Especially for sutures to heal. If your cat has had a dental and there was no teeth removed, then they're usually recovered within 24 to 48 hours.
What can be done to help your cat recover at home after surgery?
Keep things really quiet. If you have a really busy household, I would make up a room and close the door and keep it dim lighting. They need their own food, litter box, water, but just keep it quiet. Cats are, they typically will hide if they don't feel well, just because they don't want to get picked off by another predator. And if you have a very loud, rambunctious house, then that's going to cause the cat's stress level to rise, and you can't heal when you're stressed. So keeping things really quiet is good. I would try to not let them have free roam of the house. I know when my cat had surgery, and he's my baby. Like, he sleeps with me, goes to the bathroom with me. I'm not allowed to go anywhere in my house without this cat next to me. And that's not just me, it's kind of a him thing too. But when he had his surgery, he was in the front bedroom and the door was closed. Like, I did not let him have free roam of the house. He had his own litter box, food, water. I was checking on him a whole bunch, but we kept things really quiet, just to make sure we were reducing the stress. Okay, guys, I hope this helped answer any questions that you might have about cat surgery. If you do have any other additional questions, please feel free to reach out. Thanks, guys.